All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID headlines every Tuesday and Thursday on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be addressing the latest COVID headlines, as well as answering any viewer submitted questions submitted through today, the 16th of December. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today from Argentina is Sophie Buskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Buenos dias.
Buenos dias. So let's get started with some updated COVID statistics. In the United States, 61% of the population is fully vaccinated as of December 14th, but unfortunately, we are seeing a lot of increase in percentages in hospitalization, deaths, and overall cases. In the United States, we have a 7-day average of 119,000 cases per day, and that's a 73% increase over the last 14 days. We are also seeing a huge spike in deaths, 40% increase in deaths over the last 14 days, and hospitalizations have increased by 22%. And unfortunately, yesterday in the United States, there was 145,000 new cases. In Illinois, 63% of the population is fully vaccinated. We are also seeing a massive increase in cases in Illinois, 68% increase over the last 14 days with an average of 7,000. What can you tell us about this fear of Omicron and Delta and the holidays coming up so soon and this massive increase in deaths?
We're going to follow what's happening in the United Kingdom right now, and we're going to get to that story in a second. But what's happening is we had the Delta surge this well, not even technically winter yet, but in December after Thanksgiving, and we're suffering from that. And now we have the Omicron on top of that. The reason I mentioned the UK is because they're a couple weeks ahead of us with the Omicron variant taking over, and it is taking over everywhere in the world. And so they've got the double, They have the double thing. So it's a combination of the two viruses competing with each other, causing a lot of disease. Omicron is doubling every other day still. So in the United States, just a week ago, it only accounted for 0.4% of all the cases, all the COVID cases in the US. In a 1 week period of time, that went up to 2.9%. So it's still low, but that's a 7.5-fold increase, 0.4 to 2.9. So that's really exponential growth. And if that continues, which we expect it will, Omicron's going to take over by New Year's, definitely in January. Now,
right, absolutely.
That is part of what's driving this whole thing, but Delta is still very much involved, and we have to be vigilant. We know how to control this thing, and it requires getting your booster shot if you've been vaccinated. There's a big difference with both of these variants in those people who've been boosted and those people that have not been boosted. Now, if you're just fully vaccinated with the 2 shots, it works, but it doesn't work that good after 6 months, all right? So you start to lose the effect. You boost, you go back up. So it's really critical that that happens, that you avoid mixing vaccinated and unvaccinated people, that you test yourself if you get symptoms, that you wear masks when you're indoors, anywhere in public. We've come back to that, unfortunately. So we're trying to avoid another more serious lockdown type situation, but the lockdowns are going to be driven by the failure of the hospitals to keep up. And it's not their fault, it's just they're going to get overloaded. They already are in Michigan and many other places. So, just please be careful, limit those parties, just vaccinated and, now vaccinated with boosted. That's going to help you even better. So, it's not that we can't enjoy ourselves and our families over the holidays, but we've got to really be careful because we're heading into this huge peak. And this may be the worst one of all. It's really, really tragic.
Yeah, and as you just mentioned, an important new story with the UK. The UK hit a record number of cases last week with 78,000 cases in one day. What can you tell us about these two COVIDs that they're seeing in the United Kingdom?
Yeah, no, I mean, I alluded to that already. I mean, they have the both. They have more of a sort of a half and half type situation between the Omicron and the Delta variant. And, they have 78,000 new cases. They have 1/5 the population of the United States. And we've got twice as many new cases, approximately, but we've got 5 times the population. So on a per case basis, all you have to do is some simple math. You realize it's much worse over there. So I don't know if that's going to happen with us here or not. I don't know. It would. I hope not. But they aren't canceling anything over there. They're going to kind of just barge through this, but they are cautioning people and telling them to, wear more masks inside and stuff.
Yeah. And now for our second really terrible story, the US has surpassed 800,000 COVID deaths, which is the highest in the world right now. What can you tell us about this huge number that we have just passed with COVID deaths?
Well, it's a terrible milestone. The vaccines, though, have saved us from somewhere close to 200,000 more deaths. We would be at approximately 1 million without the vaccines. I mean, that's an approximate number. It's not an exact number. There are modelers that have looked at this. Like 2 months ago, it was 140,000 lives saved. I'm sure that number has gone up. I don't know exactly what it is, but it's, I mean, that's a lot of, we're talking about a lot of people. 800,000 is like the entire population of Atlanta and St. Louis combined. It's the entire population of Minneapolis and Cleveland combined. And it's actually a little bit more than the people that die from heart disease or stroke every year, in a 1-year period. Now this is over a 2-year period. But it's a terrible milestone, and the United States has not done well compared to other large, wealthy countries with the mortality, and it's really quite sad. It's very sad, and but we're going to continue to fight it, and we've got our vaccines, and now we're going to have some oral tablets that are going to help, and we still have to mask and mitigate.
Yeah, definitely. And now for some COVID questions. This individual is asking for the booster needed for the new Omicron. This individual got their booster in September, and we're wondering if they needed a second booster, which would be a 4th shot to get them through the winter and immunity. Can you tell us a little bit about any news with a 4th shot / second booster?
Yeah, you're probably going to need a 4th shot, but you don't need it right now. This person doesn't need it. Nobody needs it now because the boosters were approved just a few months back. So, the boosters are getting into people right now, right. And we'll see what happens over the next 6 months. Is this going to last 6 months like the original one? A lot of people think it's going to last a little bit longer, but it remains to be seen. But you are going to need a 4th booster. You don't need it now. Giving more when you don't need it doesn't actually help you at all. Okay, I mean, like if it's not like I can take a booster every month, I'll be better. That's actually, it may work against you. So anyway, they will need a booster, but they don't need it now.
Great. Now for our second question. This individual's doctor told them that they couldn't get the COVID vaccine due to treatment for their colitis. He said that they're immunocompromised, and because of the treatment, the shot could make it worse. Is this true, Dr. Murphy?
No, actually, this is not true. This person needs a vaccine, more than anybody because they are immunocompromised. And compared to them getting COVID, a vaccine is nothing. COVID is really going to be tough on these people that are immunocompromised like this. No, we give to immunocompromised people with arthritis and lupus and other immunocompromised diseases, colitis. It's very common, and they tolerate the vaccine pretty well, and they should take it. And their doctor, there's plenty of information to back that up. I would be happy to talk to the doctor if they were interested in referring them to me or to another expert in the field. But yeah, no, this person should take the vaccine, and quickly.
Right. And now for our third question. If a family member has COVID and no one else in the family does, and they are all vaccinated, should they quarantine? And if so, how many days?
Okay. New guidelines published on December 9th by the CDC. They're very thorough. I highly recommend you, if you have any question about quarantine or isolation, check this out. It's a nice document. So quarantine is if you don't have the infection, but you're put aside, you're isolated, you're putting yourself apart from other people until you figure out whether you're infected or not. Isolation is where you go if you actually have it. So that's a difference in the terms. So these people are vaccinated, and somebody in the family has COVID, and they're tested and they're negative. Now, if they have no symptoms, they don't have to quarantine. So they have to be asymptomatic, no symptoms. They have to feel great. However, because of their exposure, they need to get tested between days 5 and 7 as part of the quarantine in case they're one of these asymptomatic people that's infected. And they should have a molecular test. I'm throwing that in, it doesn't say that here. But, and they should wear a mask indoors for 14 days, which they should be doing anyway right now because of the number of cases is so high. So that's the current guidelines. But they actually don't, they say here to get tested in 5 to 7 days. They don't even say what test to get. So, I would think a molecular test would be better because they are more sensitive. Now, there's some new tests coming out that are pretty sensitive that are not molecular, but that hasn't hit quite the mark yet. So anyhow, this is a very nice reference, and I actually keep, because it does change a little bit every month, I always keep the most recent version handy because I get these questions throughout the day, every day, and that's important.
Right, definitely. Now for a question similar to this one, this person is fully vaccinated and boosted with Moderna. Can they become infected and be asymptomatic and spread COVID? And could they get a positive result in a rapid or PCR test?
Well, there's 4 questions here, and the answer is yes, 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 and yes. Okay. So all those things can happen. However, fully vaccinated and boosted, the rates are really, really low. All right, so good that this, and Moderna is a great vaccine. And so, yeah, they could have all those, potentially all those things can happen. So what the fully boosted people, although they do get more infections, they tend to have very mild infections. They hardly ever end up in the hospital, and they rarely die from COVID. Now, the ones in the hospitals now, 75 to 85, 90% of the people in the hospital with COVID right now and in the ICU are unvaccinated. All right, that's the driver. But there's still vaccinated people in the hospital, but they tend to be older, sicker, have an average of 4 underlying risk factors like heart disease, lung disease, or cancer, something like that. So, they're really, they're fragile. And these people are the same ones that, they can die from influenza. They can die from, many other things. They're very fragile, and COVID too. So the ones in the hospital who are unvaccinated are younger, healthier, with fewer risk factors. The hospital's full of people, all sorts of ages and very sick, and they want the vaccine, but it's like too late. You already got COVID. The vaccine isn't going to help you. Now, after they recover, if they recover from the hospital and go home, once they're feeling better and stuff, they can take the vaccine and they'll be protected for even longer.
Can I ask you a follow-up question, Dr. Murphy?
Yes.
Regarding this question?
Mm-hmm.
So if I have a friend who tested positive on a rapid PCR, is vaccinated and boosted, is testing negative on all of the rapids. Can you tell us a little bit about like sort of the difference between the two?
Well, the PCR test is more sensitive. It's measuring like a fragment of a molecule, so it's it's really, I mean, it's just fragments of the virus, not molecule, but I mean, a fragment of the protein. And it's just a highly sensitive test. And so, she could have had just a low-grade infection. It got picked up with a PCR and all the rapids are negative because they're not as sensitive. And even another PCR might be negative because it's already gone away. So that would be a very typical case, not unusual at all.
Right. Wonderful. And now for our fifth question, I apologize for all of the mispronunciations in these medical terms. This person's 20-year-old son received his Moderna booster on November 23rd. On December 3rd, he began to break out in hives. It has been diagnosed as chronic spontaneous urticaria as a result of the booster, and he was prescribed 60 milligrams of Allegra every 12 hours.
Okay.
Urticaria. Thank you. And he was prescribed Allegra every 12 hours. This did not help. So he was then prescribed amethylene. Ooh, you might have to pronounce this one.
Amethylprednisolone. It's a prednisone type drug.
Perfect.
Steroid.
And he was provided some, but never complete relief on the days that he was on the higher dosage. But now that he has finished, the hives have returned in full force. How long will this last? Is there anything that he can do to alleviate the hives?
Yeah, no. Well, I mean, chronic spontaneous urticaria, happens. All right. Now, this is 10 days after the vaccine. So this is highly suspect that it's related to the vaccine. So again, this person, because it's an unusual, complicated side effect, should fill out a VAERS report. That's an FDA adverse event report for somebody just being treated for anything. Anybody can fill it out. The patient can fill it out. The doctor of the patient can fill it out. A friend who can fill the form out. The form is not difficult. We fill them out all the time. You can get them right off the internet, VAERS, FDA, and you can fill the form out. Now, as far as the disease goes, this person needs to be under the care of a good allergist who knows how to take care of these more complicated cases. Generally treatable and quote burn out over time. In other words, they tend to go down over time. They tend to go away. So I can't answer the question, but I think what I'll do is before our next show, speak with an allergist and get their opinion on a case such as this. They're rare. It's a rare, very rare side effect, but I think it is from the vaccine. And this happens. I mean, there are side effects from these vaccines. They're pretty rare, but there's a big side effect from getting COVID. So you're always weighing the benefits versus the risks.
Yeah, definitely. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy.
Great questions, and thank you very much.